Right. So welcome everybody to the third webinar in our series of four for our Spotlight series, Research Impact. Health Translation SA has been absolutely delighted to be hosting this series and welcoming Professor Julian Grant to speak to us today. Just before we get started, I'd just like to acknowledge the lands of the Kaurna people, which is where I'm sitting today, and a number of you will be, as well as the lands of any other peoples that you may be working or coming from online today. We recognise the Kaurna people as the traditional custodians of the Adelaide region, and we recognise their spiritual, cultural, physical and emotional connection with the lands. I'd also like to honour and pay respect to the Kaurna elders, both past, present and the generations of Kaurna people now and into the future. So at today's webinar, as I said, we're delighted to welcome Professor Julian Grant, who's going to give us a little bit of insight from the work that she's just starting at the NHMRC Health Research Impact Committee, and I'm sure a few other tips along the way about assessing impact and boosting your impact from your work out into the world. We also have one more webinar in this series for the Spotlight series that we've been running, which is this coming Friday, the 8th of April, and we'll be looking at impactful projects. So having some case studies from some high impact projects that have been working with Health Translation SA in recent years and announcing the HTSA Research Impact Award. And we're looking forward to bringing you that on Friday. So just before I hand over to Julian, I'd just like to introduce a little bit about HTSA for those who aren't familiar with us. So our purpose here is to accelerate the translation of research findings into both healthcare practice and policy, and also increase whole of system research translation capacity with the end goal to improve the health of South Australians. So I guess this webinar series and today's session is really about that, boosting the capacity in the system. So providing some knowledge sharing and some information and a bit of a springboard to perhaps go and for you guys to learn a little bit more about research impact as you're interested with the resources and the information that we're sharing. The way that HTSA works is really through collaboration with our 11 partners that are really central to everything we do. So we work with our partners and other stakeholders across South Australia and nationally as an independent catalyst and a broker, and really that's about mobilising collaborations across the system to address major health system challenges and really bring research into that unmet need. So you can see on the icons there, we're really trying to bring health services and research together with other key stakeholders, engaging community and bringing consumers and raising up their voice in the work that we do, bringing education, training opportunities and changing practice and policy. So I want to say recently, but it's 6 months ago now, we've had launched a new strategy here at Health Translation SA, and I won't go through all of this in detail, but just to note, we are working in 4 core objectives. It's really about bringing the right people together, building the right environment, and getting the right projects done, and in all of that, we're really looking to celebrate and showcase impact. So again, these webinars are helping us in that, building the right environment, building the capacity of our researchers and our health services personnel to improve our research translation and have impact in the real world and make changes to people's health in the long term. So that's enough about us and enough from me. So I'd like to really welcome and introduce Professor Julian Grant. Julian is a Professor of Nursing and the Associate Dean for Research in the Faculty of Science and Health at Charles Sturt University. Just a little bit of background, and you'll forgive me reading off the notes here. Professor Grant's research has focused on understanding the individual and systemic barriers for the nursing and interdisciplinary workforce, tasked with promoting the wellbeing of children and young people, particularly in relation to those who are vulnerable due to intersections of race, gender and class, and those at risk of or exposed to abuse and neglect. Professor Grant is a current member of the NHMRC Health Research Impact Committee, which functions to promote, communicate and measure the impact of NHMRC funded health and medical research. So I will stop sharing. Welcome, Julian, and I'll hand over for you to start sharing your screen and take it away.
Great, thanks, Annalise. I'll just get my screen up and running, and I will share this one. And I'll just get my presentation up. And I will just, whoop, hold on, I'll just move that out of the way and then share my screen. Whoop. Okay, so can you see the front page of the presentation now?
Yes, we can, thank you.
Awesome, thanks. So hi everybody, and thanks so much for making the effort in your busy days to come today. I think that's the first thing that we all need to recognise. And thank you for the lovely background information, Annalise. I won't introduce myself any further. And I just want to make clear before I say too much that I am here in my capacity as an academic who works at Charles Sturt University, but who in that role I sit on the Health Research Impact Committee for the NHMRC. So this presentation isn't from the NHMRC, it's my perspective of health impact from that role, just so that we're very clear and don't get muddled about my role in amongst all of this. So addressing impact insights from the NHMRC. So before I say any more, I'd really like to pay my respects to the traditional custodians of the lands and waters upon which we all meet. For me, this is a lovely picture for my morning walk where my dog and I walk on Wiradjuri country. I'm here in Bathurst in regional New South Wales. Charles Sturt is a very big university in regional Australia, and we also walk on the lands of the Ngunnawal, Gundungurra and the Biripi nations. So I'd like to pay my respects to all of those peoples, and also, of course, the Kaurna peoples from the Adelaide region, from which most of you are coming from. I'd like to recognise that connection to land is as strong now as it ever has been, land that has never been ceded. And I'd also like to pay my respect to elders past, present, and those, of course, who are emerging. And I'd also like to particularly respect anyone who might identify as coming from a First Nations background who's joining us here today. So looking forward to getting on with this presentation. So this is a really unsettling image. Why am I showing you this image? If you just slip back to this image, what you're seeing here is this beautiful creature ready to pounce. This is my metaphor for the shiny grant application. I'm great. I know I can do stuff. Just look at me, look at me. You get here, what I'm actually seeing in this picture is impact. This picture is all about impact. This tells us what happens from the actions. Yeah, very clearly, same story. This is about impact. This tells us demonstrable evidence about what can actually happen. So when we're considering impact, we have to consider it in everything we do. The evidence that will enable recording and measuring your impact, from grant writing to successful grant activities, both content and process, dissemination and tracking. So I'm going to talk about today a little bit about the background of the NHMRC position around the Health Research Impact Committee. A little bit around impact. I know you've done some work on this already, but I gather the audience is mostly early career researchers. So I just want to make sure we're all on the page around what impact actually is, and some strategies around how to actually get there with that impacting. So I'll start with the NHMRC's strategic themes and purposes. If you have a little look at this image, this is from the NHMRC's corporate plan. you can actually see that the main pillars here are around investment, translation and integrity. And of course, it's Health Translation SA that are hosting this, so you know translation's core. But if you consider the notion of impact, impact comes mostly at this point of translation. It falls in that region where we can see research is impacted and translated into clinical practice, into policy, and into health systems. The other thing that you'll notice here in translation is the commercialisation of research discoveries, which is a growth area that we'll be seeing a lot more work on into the future. So if we consider where the Health Research Impact Committee fits, this is the NHMRC's governance structure. So the NHMRC Council and Principal Committees are appointed every 3 years. And this latest triennium is from the 1st of July 2021 until the 30th of June 2024. This is the first triennium that a new principal committee, the Health Research Impact Committee, has been established. And that's based on the NHMRC's emerging appreciation and need to link much more closely with industry and commercialisation to make sure that whatever they're funding leads to change. And you've probably all heard that 17-year gap from when research is done to research is implemented. This is part of what this is about, to actually make sure that time is cut down and is much quicker. So this Health Research Impact Committee will advise on policies and strategies to promote, communicate and measure the impact of NHMRC funded health and medical research. It'll look at strategies to facilitate the translation of research into clinical, public health and commercial outcomes, and strategies to foster embedding research into health systems. So membership of that committee comprises researchers, clinicians, economists, business representatives and consumers, consumers with experience covering health services, health systems research, clinical medicine, public and population health, social sciences and multidisciplinary research and basic science. So it's more than core researchers who are actually out there writing the grant applications and doing the research. It's a lot of end users and a lot of people that could use the research that's been developed and make an impact on health outcomes. So for example, like I sit on that committee, what I can offer to that committee is my background's in nursing, and particularly in community health nursing in regional and remote areas. So what I offer to consider the impact of health research is a female gendered approach, a rural and remote healthcare perspective, and perspectives from an ethnographer who works with children, families, and a health workforce to address child health inequities. This is not all about trialists, which is often people go, NHMRC, oh my gosh, they're only about trials. They're very clearly about a whole lot more and they really want to make a difference. So if we think about the strategic priorities for 21 to 24 triennium that we've just mentioned, you can see there are 6 listed there. And of those 6, research impact is core. So this whole committee to advise the council is about research impact. So to some definitions. Impact, and this is the definitions by the NHMRC, and you can see down the bottom there, that's the website that I've gotten the information from. Impact is classified as the effect of the research after it has been adopted, adapted for use, or used to inform further research. Research impact also includes research that leads to a decision not to use a particular diagnostic, treatment or health policy. Now that's a really tricky one, because even though our ethical standards of practice say that we really must publish things that don't work if you look in the literature, it's really hard to find those. Most people don't publish that piece of work, but impact is very much about making the right decisions using the research that we have at hand. The NHMRC defines the impact of research as the verifiable outcomes. This is the piece for all of you to hang on to. If you remember nothing else from this presentation, remember it's about verifiable outcomes. How are you going to verify them? It's verifiable outcomes that research makes to knowledge, health, the economy, and or society, and not the prospect or anticipated effects of the research. So just to come back again to these pictures, this is prospective research. This is what you're hoping to achieve. These are the verifiable outcomes. Horrible pictures, but hopefully that helps get them into your brain around this is exactly what you need to be telling us. At the moment, the Health Research Impact Committee is new. We've only had one formal meeting, but what the design for us over the 3 years is to consider evidence and start to draft up some much clearer guidelines around how we as researchers can record and measure our impact and all different types of impact. And so that we can then use that into our grant writing right through to implementing successful grant activities from a content and process dissemination and tracking perspective that I mentioned earlier. So let's take a minute then to think about the types of impact. Now, hopefully you're all absolutely aware of these. Again, these are on the NHMRC website, and these are the sorts of things that into the future, you would hope that anyone that is writing a grant will know. If I'm talking about impact, these are the ones I need. I need a subheading for each of these: health impact, economic impact, social impact, and knowledge impact. So as really simple examples, health impacts can be evidenced by adoption of policies or programs or clinical guidelines. That for us is quite often the easier one. Economic impact can be measured by new drug or devices for registration, and that's often the really long haul. Economic impact can also be evidenced by granting of a patent or a research contract with an industry partner. Now, most people even aren't aware that that stepping stone is still classified as an economic impact. And evidence of active collaboration is an economic impact. Knowledge impact, we don't really need to talk about too much. I think we're pretty all across the page on that one. It's mostly about citations, in particular field-weighted metrics for those disciplines that are citation-based disciplines, prizes and things like data sharing. Now, social impact is a little bit harder to evidence quite often, so I thought I would just show that one to everybody so that we can have a little bit more detail on that one. So if you think about social impact, what we're looking for in the middle column here are improvements in the health of society, including the well-being of end users and the community. Now that's the sort of research that I do, that I'm always trying to make an impact with, but it's really hard to demonstrate tangibly. So if we jump straight across to the right-hand column, you can see that's the list there of some examples of what demonstration, verifiable evidence is of social impact. So an uptake or a demonstrated use of the evidence by decision makers and policy makers. So has an organisation, a health service, for example, made a decision to make change because of what you've done in your research? I'll just go back to the middle column again and look at the next one down. So other examples of what social impact might look like. It might include improved ability to access healthcare services. Now, for me, living in regional Australia, as you would be well aware, access is one of the biggest issues that we have, especially now an additional barrier to access is our fuel price. Fuel prices have gone through the roof and people can't afford to travel 2 hours to access healthcare. It's a really dire situation. Other things that might demonstrate social impact are participation socially. So that includes empowerment and participation in decision making. So enabling people, for example, to attend co-design activities, to socially participate in a research activity or in a health enabling activity. And the last one there is to quantify improvements in the health of society. And that one, quantifying, is of course with our larger data sets. So if we move across to the right-hand side and look at the rest of the evidence measures that we've got there, the second one down talks about qualitative measures demonstrating changes in behaviours, attitudes, improved social equity, inclusion or cohesion. And for a lot of you, you would be aware that historically qualitative measures, including qualitative research outputs, aren't scored as highly generally, especially if we're talking about publications, knowledge impact. In the citation scores, they really don't claim the space in the same way. Qualitative doesn't claim the same space as quantitative measures. So it's reassuring to see here for social impact that qualitative measures that demonstrate change are now included here in social impact. We also have some others, such as improved environmental determinants of health, improved social determinants of health, and changes to health risk factors. So that's just a beginning. And as I've mentioned, recalling that this Health Research Impact Committee is at the beginning of its service. So we won't see until, I would imagine, towards the end of the second year, some of these examples being much more tangible and much more easier, or not easier, much more clearly able for us to measure. So let's think about, when do you have to consider impact? When should you be thinking about impact? And clearly from that image, it's not rocket science. We need to be considering impact of what we are thinking, saying and doing at the very beginning of everything we are thinking about constructing, when we're co-designing or when we're doing things in a research team, right at the beginning. As some of you may be aware, in a most recent example, the MRFF 2021 early to mid-career researcher grant opportunity. They've also got the mid-career researcher grant opportunity, supporting some colleagues with writing those at the moment. And you can see that the grant proposal has got project impact as the first item to be addressed. So rather than stepping through, here's the problem, here's what I'm going to do, they want to know what is going to be the impact of your research at the top of the page. So it's rising to the surface and we need to be able to rise with it. So what I'd like to do is just give you a little bit of an example from the Safely Sleeping Aboriginal Babies in SA Doing It Together project that myself and some colleagues, you'll see the team written there on the screen, that we've completed this study. The project was funded through approved disbursements from the MRFF Rapid Applied Research Translation Program through Health Translation SA. So I think it's useful to use an existing project to step through how we managed this. I'm not saying what we did was perfect, but we're reasonably comfortable with the impacts from the end to date. So we'll just share those with you and share the learnings. So with this project, our proposed impacts, and these come directly from our original grant application, were to increase family and community knowledge and practices about safe infant sleeping. And when we're referring to family and community knowledge, we were referring specifically to families from First Nations backgrounds, because we know that families from First Nations backgrounds, babies experience SIDS, sudden infant death syndrome, and SUDI, sudden unexplained infant death syndrome, 3 to 4 times more than the mainstream population. The second impact was improved and shared common knowledge for health workers. So that included health workers in the interdisciplinary workforce, from AMIC workers, Aboriginal maternal infant care workers, child health nurses, midwives, Aboriginal cultural consultants, everybody who touches base somewhere along the line with families who are birthing. Our next impact was that Aboriginal families would have access to a culturally safe sleep alternative and be able to provide that the health service in mainstream health services would be able to provide culturally safe education for families that were, for whom they were caring. And the final one was provision of evidence for change in the infant safe sleep policy in South Australia. So this is what we were hoping to achieve. The study's finished now, and what we can say is that on the 8th of December last year, we shared some of the findings from this project with an industry roundtable. I think I've just said that, on the 8th of December last year. And what we did at the roundtable was shared what we found and then listened to what industry told us about the project and what they'd like to see next. Now, the way that I've just communicated that makes it sound as though that was our one touch point with sharing information. We had touch points all the way through, and collaboration and feedback all the way through. And I'm not going to go through these slides, but it's just a quick glimpse to show you that what we used was some infographics, and these were for distribution. So this infographic was specifically around our education blitz. And so this was about what the sharing of current contemporary knowledge about safe sleeping around for health professionals and what the results of that study were. The next one talks to the information that families generously shared with us around their experiences of taking part in testing out the PepiPod program and how they actually found that program to be. And you can see from the qualitative information, the core one that we've pulled out was, if I didn't have the pod, then I probably would have co-slept with this baby too. I was so tired because I never really dared to sleep. I was so worried that I would roll onto baby. So this pod was a godsend. I loved it. It made me feel safe and secure. So one message, and this one message was one of the messages that we were able to share with the teams at the round table to actually consolidate some of the work that we were doing. And of course, as you would know and be aware, we're also using knowledge impact for mainstream academic publications, but this is the piece with industry. Then the last infographic that we've got here is the quantitative data that we collected from the parent experiences of using the PepiPod program. Emphasis on program because it wasn't just about the safe sleep device, it was primarily about the information sharing, which is what the parents ended up telling us was the most important piece of the puzzle. So on this last slide, we talk about one of the biggest messages that came out of the project, which was around, is it actually feasible to translate across cultures? Can we actually do that in mainstream health services? And we were able to have this yarning session. So if we come back to what the impacts from these that the health services shared with us along the way and during this round table, they include informing revised SA safe sleep policy, where a member of our project team is now on the policy review panel. Our aim with that is to ensure that First Nations ways of knowing and being are central in the content and context of safe sleep communication and education in the policy. We also know as an impact that Lowell McEwen Health Service have purchased pods and are looking to ways that they can develop the program with their First Nation families that engage in birthing through that service. We also know that KidSafe SA have purchased the Peppy pods and are also looking to manage the way they can rent out the Peppy pods and embed the Safe Sleep program into their services. The education module that we developed has been transferred to SA Health for incorporation into staff orientation and education. There's so much more we could talk about with the nuances, but with the interest of time, I'm going to sort of leave it there and wait for questions. But one of the things from our learnings is that I would start, if I did this all again, and if the next things that all the grants that I've written since, we now start with a program logic. I know program logic is embedded into health service behaviours. It's not always embedded into research of behaviours, but with a program logic, you actually start with what you want to see change. I'm currently working in a first 2000 days project with a consortium of an Aboriginal medical service, a local health district, the Departments of Community and Justice, a PHN and Tresillian care services up in the Northern Rivers in New South Wales. And what we're doing, we've started with the program logic to actually go from there. And now we're evaluating the outputs from that. And those outputs are very much around what is the impact for families, service providers, and the community. And in that community, particularly First Nations families and growing up strong babies. So, the next thing that I would say is that if you are ever unsure about impact and health impact, I would look to the NHMRC case studies. Now, I understand from Annalise, you're going to be talking about those at a future presentation. Is that correct, Annalise? Yeah.
But not the NHMRC ones.
Okay.
But we will be sharing the case study website tomorrow.
Great. Yeah. So I won't
on Twitter and all all things social.
Yeah, of course. That's fabulous. So I looked at these and I thought, why haven't I seen these before? And I think one of the things that we need to do as part of the committee is find ways that we can share these more broadly and encourage people to not be frightened by the length of impact here. So I put this one up because it's relevant to the zone that I work in. But if you have a look, the first date on that is 1966. And it goes up to 2010. And for all of us, we may well be going, oh my gosh, I could never do something like that. I would say think big and plot your graph around what your impact is. And even if your impact at the moment only starts 1 year, 2 years, 3 years, start getting your graph in, start doing it yourself and start recording it, because I suspect over time, especially with ERA Excellence in Research Australia requiring the threshold standards now, we are going to be asked more and more and more for evidence of impact, not just for research grants, but for our performance as academics and how we can actually help health services and communities and families to actually have healthier behaviours and live in healthier ways. So with that, I'm going to end on that and say thank you very much. And I'm really happy to take questions. I can't guarantee I can answer them all because, as I said, it is a new committee, but I'm really happy to have a bit of a yarn and answer any questions you might have. So thank you.
Thank you, Julian. That's fantastic. I'll invite everyone to be having a think of their questions. You can either pop them in the chat or just absolutely feel free to unmute yourself and sort of put your hand up and that way. Just while people are pondering, I think as you were speaking there, the few things jumped out at me. I think remembering that notion of impact through disinvestment from, you know, low value care or from
Yes.
you know, ineffective services,
Yes.
is something that often stands out to me, because I think there's, you know, there's so much room to do more of that. So I love that that was, you know, in that definition from the NHMRC that you shared with us. And just as well, that prompt around what is the verifiable outcome and impact, and just seeding that into our heads about how are we recording and tracking, you know, our outcomes as they're moving towards that impact pathway, and not waiting till the end and then trying to look back and think, what did I do or what came out of that? So that notion of record, snapshot, track, and building up that picture over time was really coming to my mind. So thank you for sharing that. And then the other thing, I guess, for me was that you mentioning about the stepping stones, and we talk a lot, we have done in these last couple of webinars, around what's the adoption by both the next user as well as the end user, and trying to really look at what and acknowledge that stepping stone and that passing of the baton both to the next user, but then that think big, imagine what's your end user sort of looking like. So it's lots of you know, beautiful alignment to these things we've been sort of seeding as we go. So that's been that's been really fabulous. So thank you, and thank you for the example. I think it's great to have a specific project to look at how it's applied. So we've got Akushala's just raised a question, is do you use any specific tools to make capturing that impact easier?
It's a great question, Kushala. I no, we don't use specific tools, but I think one of the core tools is really around changing our mindsets. It's not about a written tool or a piece of something that you can just pick up and use. It's really, I think the most important tool is that changing our mindsets to know that that's something we need to be planning for, recognizing and capturing along the way, all the time. And I think that's something that we I've been so fortunate in this last project. The learning from the First Nations colleagues in the room was just, and when I say room, in the team, was awesome, because it's really that opening up the mind to the different ways of knowing and being, and things that I may not have considered as being you know, something that is recordable and impactful, that another person may from a different mindset. And I think it's that opening up our minds is the biggest piece, but tracking it as you go, absolutely, and starting with the end in mind, but knowing that the end isn't a definitive future point, that what is at the end will shape shuffle along the way. So some of the outcomes and impacts that you end up with may not be what you planned. Yeah.
And so next question has come from Tamika Hayden. So we'll comment really is she's just saying that knowing what and when to capture your impact is different to having somewhere to keep it. So actually in that mindset, what, you know, knowing what and what you're doing, what you're trying to capture, different to having a system for holding that information or recording, I guess. And Tamika is suggesting that people consider having an impact CV or otherwise a specific sort of folder or location that you're actually keeping your records of what you've captured, so that you again can keep track of it and not losing it in, you know, it sort of sounds like a simple thing, just logistically somewhere to put it, but actually it's important, because you know, if things are saved all over the place, it's easy to lose.
I think the other piece to that, you know, with the mindset piece is, and as researchers, we often don't value the thinking time. We're very much about, these are the tasks that we have to do and get done, and quickly let's get them done, because, oh my gosh, there's always a time pressure. And again, one of the learnings from this last project is really valuing yarning time. So because what I might think is impactful, it might not be for someone else. So it's that open-mindedness, the space for thinking and reflecting and yarning and listening. Yeah.
Yeah, and actually I think Tobias Scoop spoke last week about that I guess aligning the expectations and what you're imagining your impact will be, or is what you're hoping for it to be, and what are your stakeholders and the team around you and the potential users of your work, what are they hoping the impact will be?
Yes.
And being open to understanding those, how those things align or they don't align, and how you're going to move forward with those different perspectives. So
absolutely, like one of the key things from that there has been emerging over time, and we've got clustered, should I say, clustered data that informs this. But one of the things that came out really absolutely key by our First Nations participants at the round table was, for example, it's not enough to have in the policy that the sleeping options need to be culturally safe. It was about messaging, and it was very much about the fact that it was First Nations people need to be involved in the messaging at every point. And, it's like knowing, okay, so if we can get that in, the impact of that to retaining culture, culturally safe practice, and culturally safe impact for families will be enormous. We're not there yet, but that's, what we're working on. Yeah.
I'll give everyone one more moment to keep thinking about another question. I just had I guess a bit of a structural question. I know it's new, but in terms of the Health Research Impact Committee, so can you just give us explain a little bit about what sort of, I guess, feedback or input that's having back to the council, like in terms of, setting that up and its purpose and its channel back to, influencing
I probably can't discuss the business of the committee, sure, because that is in confidence. But the role of the committee is to provide feedback to the council when they're making their decisions. So the council, for example, will say this is a section of work that we are looking at the moment. Then it comes to us, and then we look at that section of work and go, okay, is impact embedded in that section? How are we going to embed impact in that section? And what are the possibilities of measuring impact in that section? And then the other really important piece is around equity, around impacts, especially for health. And there are a number of people in positions on the committee specifically to enable consumer voice, to enable, regional remote voice, to enable, different types of health services, AMS. As you would know, there's a First Nations committee that underpins everything across the way. So it's really about having the discussion, the debate, and then providing feedback back to the council so that they can then make their final decisions. Yeah. Does that kind of explain it? I don't want to use specific examples because that's...
No, I think that's good. It's just, I guess, you're helping us to sort of understand it. The committee is, I guess, making, raising up that perspective of impact and the importance of impact beyond some of those traditional publications and other means, and I guess making that really tangible and explicit, that impact is being considered by the council, more and more perhaps through this structure.
So can I ask a question? Yeah, so that was more what I was interested in, because I think like we're coming from, I'm really interested in implementation of evidence and sort of things. And so a lot of the time you worry that the grants committee is going to be just looking at citations or just looking at income. So now that I didn't realize I had this impact team, but do you feel that there's a real cultural knowledge shift and understanding what impact is and how to look at it?
I do. I absolutely do. And I think because of the long history of NHMRC being, the quantitative, and to use colloquial language, it's like the big hitting trialists that get all the money, quote unquote, that's what people say when they're being negative. I feel incredibly confident that in the hands of Kelso at the moment, the big push is around making sure that the quality is there. There's still a quality committee. There's no loss of quality that we're talking here, but that we are looking at impact from a range of perspectives that haven't entered into the argument in the past. So yes, I do feel very confident that that's there, and they are asking all those questions around impact, how we measure it, what it might be, how we can describe it, quantify it, track it, and that's the work that we'll be doing over the next 3 years. Yeah. Does that answer your question, Liz?
It does, because it's more just I'm wanting reassurance that there's almost a cultural shift in the way the grants are going to be looked at.
And I think if, again, like I made that point at the end, if you look at you know, Excellence in Research Australia at the moment and the threshold standards that have been released, and that there's shape shifting in how all of that is measured. You know, universities now are very much required now to demonstrate alignment between their education and their research, and part of that is the impact piece. So I think it's sort of threading across, it's not just siloed. So I think all of us will get much better, or we will have to get much better over time.
We may have had a small interruption there to the feed. Oh, good. And we're back.
Yeah.
We just lost you there for a second, Julian. Sorry.
Sorry.
That's all right.
I've just got a notice that says my internet is unstable. Welcome to regional Australia. Yeah.
Sorry, we just lost the end of that statement there, but
I can't remember what I was even saying.
That's all right.
It's about the thread of impact through everything we do, and I love that idea of the impact piece on your CV, because we are really going to need that more and more and more. Yeah,
great. And actually, on the Health Translation SA website for our Spotlight series on research impact, we did just we have linked to the AMRI impact CV information and template, so that might be something that people might be interested to go and have a look at as well.
Absolutely. And I noticed Tamika said, does the committee consult with the sector more broadly in making those decisions? As you would have seen on that slide around the structure of the councils, there's three committees that report to the council: the research committee, the health research impact committee, and the Australian Health Ethics Committee. And then sitting underneath that is a consumer and community advisory group. So they are always consulted in that process. And there's a principal committee, Indigenous caucus, that sits underneath all of that as well. So I'm relatively new to this committee, and I am, like Liz said, I am reassured with the breadth of the consultation that is going on at the moment. And then the other thing that happens, depending on what work is proposed by the various committees, is that they can set up, or they have the capacity to set up specific working committees. So if there's a particular issue that arises that the expertise isn't clearly enough in the bigger committees, they'll set up a working committee and pull in other people to specifically attend to that. So hopefully, Tamika, that answers that question a little bit.
All right. Is there?
Can I ask another one?
Yeah.
So another thing, I've been working with teams doing like randomized controlled trials where they're trying to see does something work or not. And then as part of writing up the grant, needing to write an impact piece, and they're like, well, if we don't know, if we don't know it's going to work, we might not change anything. So, and I know that you'll change knowledge because you can do what you do with more clarity, but I'm just thinking of this woman I was working with, and she was saying that when she's looked at grants, people say we're going to change the world because we're going to show this, and then we're going to change practice, blah, 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 blah. And then she thinks, so how do you write up an impact piece when you actually don't know if you should change anything? Do you know what I mean? Because if you, and it seems it sounds ever so much more fabulous to say you're going to change stuff and it's got to go into guidelines and you're going to change the way healthcare is delivered. But in fact, that's quite irresponsible in some ways if it's not effective or it's wasting time.
I totally hear where you're coming from, Liz, and the importance of being, you know, not like that tiger shining too bright and actually being tangible about what you can achieve. I think it's about being really clear about the impact in that case from what you're talking about will be to inform that changes in practice are informed by the best available of evidence that doesn't exist at the moment. So what we'll be doing is providing you with this piece of evidence from which you'll be able to change practice to do X, Y, and Z, or you'll be able to change practice to do X, Y, and Z. So it doesn't, you know, if your findings come up and say that this isn't going to work and it's terrible, well, then you're still informing practice by saying it won't shapeshift, or you'll look at other ways to shapeshift it. Does that make sense?
It does, but it doesn't
shiny. Doesn't sound as shiny, but
and
it's much more tangible.
I think it's much more responsible, but it doesn't sound as fabulous, you know, because if you're saying, is this new treatment effective, or should we just do usual care? Yeah, actually just do usual care. We still usual care is not that great, but your treatment's no better than it.
And I think what you'll be saying, of course, is our evidence says we've got this much evidence to show that this isn't likely to work. Therefore, we're trying it. And if it does work, this is what the impact will be. And then you have to do the full circle back to what your evidence is that this will work. Yeah, and include that in your circle. That's what I would be doing. Yeah. Does that make sense?
It does. Yeah, it does.
Yeah, we like shiny, but
shiny looks good.
Yeah.
Fabulous. All right. Does anyone else have any further questions? Nothing leaping out. Tick, 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 tick. Great. No worries. Julian, thank you again, and thank you to those who've just asked questions. Some really interesting perspectives and discussion. Oh, I have a hand raised. Yes, Tamara. Can you, Tamara?
Oh, that might be just a thank you, and we're over. Yeah.
Tamara, did you want to ask?
Sorry, that was a clap.
Oh, it's a clap. Sorry. Great. I like it. We can have actual visual clapping as well. So, yeah,
I think it might, like, if you're still running these at the end of next year, I'd be more than happy to come on once some more work has been done on the committee, so that we're able to, you know, feedback some of those more tangible pieces. But it is at the beginning, and it is a flag that we all need to be doing more in this space. Yeah.
And I think I just would like to thank you so much for you know, for your information and your case study there, and for being willing to come and talk to us in this sort of setup phase and just help us understand that this structure is being built in, and that impact is, you know, is there, coming in front and center more, and hopefully we're seeing some of those different types, and as you say, the equity in the impact, you know, going forward, which is going to be so important. So thank you to everyone for your questions and attending, and thank you, Julian, for sharing your knowledge with us. As I had said at the very beginning of the session, we do have one more webinar this coming Friday, which is going to be on announcing our Research Impact Awards here at HTSA. So we'd love you to join us for that. Otherwise, if you want any more information about our series or the work that we do, please feel free to email us there at inquiries@healthtranslationsa.org.au, or follow us along on LinkedIn and Twitter, where we're sharing a lot of links and other resources and toolkits and things. So thank you again for your time, and we'll hopefully see you at the next one.
Thanks, everyone.
Cheers.
Thank you. Bye.